My name is Hannah Huston, and this is my OR design presentation. To start the presentation, I wanted to walk through the key with you guys, and I wanted to explain why I put things where, and then I was going to take you through the OR as a patient coming in for a procedure. So main things, we've got the doorways that are going to be marked by these black cubes. Blue is going to be indicating restricted areas, orange is indicating semi-restricted areas, and then green is unrestricted areas. On the note of the unrestricted areas, this flow of traffic is generally unrestricted. However, I didn't want to just glob green onto the entire floor plan because I felt like it would make it more difficult to see where things were separated and to see what the flow of traffic looked like. But this white is also an unrestricted area as a general statement. The semi-restricted areas are the orange, and then we have red lines along the ORs, as well as sterile storage, central sterile supply and processing, and the decontamination elevator to indicate where restricted or semi-restricted areas are beginning. So that is running through the key. As for placement, I intentionally placed pre-op in a separate room from PACU and the OR to minimize patient anxiety prior to their procedure. It was something that our textbook discussed, so I wanted to make sure that I implemented that. PACU, it didn't specifically say to separate, but I thought separating PACU was also beneficial to the patient in terms of their mental well-being prior to the procedure, given that I think that seeing a patient post-procedure could be somewhat anxiety-inducing for anyone who's going into a procedure that day. As for the departments that are auxiliary departments to the OR, I placed them close. That way that if any samples need to be examined or anything needs to happen before, during, or after the OR, they're right there, right next to you. Not something that you have to go up to 3 floors up and to the left, to find the lab. So they're close because they'll be used semi-frequently within the OR. And then PACU is right here. The main reason I put PACU here was just because I wanted it to be separated from pre-op. However, it also is convenient having PACU right next to the OR, as it just helps with transitioning patients from the operating room into the post-anesthesia care unit a lot quicker. And then I feel like if there are any complications, it allows for complications post-procedure. It allows for them to be taken back into the OR semi-quickly and efficiently if need be. As for the semi-restricted areas, I tried to keep them separated somewhat from the OR, but also close. I didn't want them attached to the same block as the OR was, because obviously they're dealing with contaminated instruments and equipment, and so I didn't want I just felt like since the OR, substerile, sterile storage is basically our clean block, I wanted to keep those separate from that specifically. One thing to note with the lines that I have that are marking the beginning of restricted areas, I didn't put any on the substerile rooms for the ORs. This is because the substerile rooms are only accessible through the OR. So by entering the OR, you're already going into a restricted area. And since substerile is also restricted, but only accessible through the OR, I didn't feel like there was a need to indicate that it was also a restricted area. That is the general layout and why I put things where. As you can see marked by these lines, this is the general flow of traffic, but one thing to note as well is that there will be some traffic along this corridor because the women's locker room is there and the men's locker room, but that will mostly be employees only that are accessing that little corridor. One more thing is that the entrance and the exit is the same doorway, and that was to minimize any contaminants entering into this general back area where the operating is happening. So those are the main key points on why things are where and what the flow is. As far as a patient coming in for a procedure, you'll enter through this entrance. You'll go check in with the control desk, and then you'll wait in the waiting room. We have restrooms accessible for patients if need be, as well as offices if there were any questions that the patient had prior to surgery. Nurse will call them back. They'll enter pre-op holding. In pre-op holding, they'll get prepared for surgery. And then once they're ready, they're going to go through this doorway right here. And then they will be in kind of the main block of our OR department. Any of these ORs can be used for anything. However, I did specifically make 4. So this one here, this one, and this one. I made 4 of them larger ORs to accommodate for trauma if they needed to. That way they can have extra equipment or additional instruments within that room ready to go. So we're just going to say you're coming in as a patient and you're getting plopped right in this corner OR right here. So you're going to come around this little block and then you're going to go in. Once your procedure is done, they're going to take you to any of these PACU rooms. And then after you're done in PACU, depending on whether you're staying overnight or you're able to leave the same day, you're going to go through this door, and then again, the same door we entered in is going to be the final one that we're exiting through, and then you're going out the entrance. And of course, that would be for a patient who doesn't have to stay overnight. We'd have a separate department for like recovery rooms, overnight stays, things like that. So that was the general flow of it, and that is what it would look like for a patient entering my OR design.